So we were talking about STEMI, NSTEMI. We're talking about chest pain and the different how do you diagnose STEMI versus NSTEMI for versus angina and angina. So let's go ahead and keep going. So let's say a patient presented with NSTEMI. So these are the patients who have maybe some subtle EKG changes or no EKG changes at all. And then they ruled in with cardiac enzymes overnight. So you started them on aspirin, Plavix, beta blocker, statin, nitropaced, and again you're probably on heparin drip as well. They continue to complain of chest pain. So you put the nitropaced on these patients, and then you're hoping that that would take away the pain, but it didn't. Again, nitro, be careful in patients who have right ventricular MI, and that would show up in the V4, 5, and 6 because they are preload dependent. And we have a case that's actually going to talk about that as well. But you put this patient on nitropaced, they continue complaining of chest pain. What would you do next? The point of this case here is that these patients, if they're not doing well on nitropaced, then we change that to a nitro drip. Okay, so we put them on a nitro drip. So they're getting a nitroglycerin continuously, and we put these patients in the ICU. And again, at that point, you call cardiology so that they can get a heart cath the next morning. Hopefully that subsides their pain. Now, if their pain doesn't go away and you see them, you're doing your admission or you're going to see your next patient, and then you swing by and you see the patient holding their chest like this and they're complaining of chest pain and they're not relieving it. This is Levine's sign. When they're holding their chest like that, this is classic for coronary artery disease. So what would you do next? So in this case, you try the nitropaced, the nitro drip, you put them on the old medications, you give them pain medications, morphine, they're still having severe chest pain. In these cases, you want to call cardiology now. If it's 2 o'clock in the morning, 3 o'clock in the morning, I don't care. Call cardiology now. Tell them that these patients are still having chest pain despite everything you have done. And these patients will benefit from going to have a heart cath more sooner than later.